Hey, I'm Dr. Dino Pappas. Thanks for joining me. The views in this video are my views and my views alone. They do not represent the views of any entity or agency that I may be affiliated with. Today's vlog is going to be about chemical versus mechanical pain. Let's rewind here and let's tell a little story. I recently have set some patients out, referred them out of my office. I referred them out of my office because they had excruciating nerve pain going down the arm or down the leg. When a patient starts to say they have high-level pain, there's nothing that they can do to make it better. They have numbness, tingling, burning, pins and needles. They can't get any relief. They can't get any sleep. As a human being and as a doctor, it's my responsibility to try to get them out of that type of pain as quickly and as easily and as efficiently as possible. And in some cases, that will trigger a referral. The problem with these cases, when I refer them out, I had one patient that went to a neurologist who literally told the patient, put your finger in the back of your neck, press on it every day for several minutes at a time, repeat that several times a day for 6 weeks, and if the problem doesn't go away, come on back. And that kind of aggravated me as a provider because this neurologist didn't realize the patient was there because of chemical pain. So let's break this down for you, especially if you're a patient or a potential patient. What is chemical pain and how to get treatment for it? Chemical pain, constant. There's nothing that you can do to make it better. It is there from the time that you get up to the time that you go to bed, and there is no break and no interruption. If you have that, you may not be the right candidate for the conservative care treatments, chiropractic manipulation, manual therapy, rehab, things of that nature that we typically provide in our offices as conservative care providers. Inflammatory pain, it's inflammation. It is chemically driven, which means what? Inflammation is a chemical process. The only way to treat a chemical process is via chemical means. Again, that's chemical inflammatory pain. There's no relief from postures, positions, mechanics. Nothing you can do. You can't move your neck in a certain position and undo that pain. You can't move your spine in any positions to undo that pain. No relief from any of that. Rest doesn't help because it's not a chemical-based treatment. Those are all mechanics and postures. Therefore, they won't help. Last thing, you may need some anti-inflammatory agent. And what is an anti-inflammatory agent? A prescription or oral steroid, a prescription non-steroidal anti-inflammatory. And heck, even things like turmeric, which is a spice, even things like using high doses of omega-3 fatty acids like krill oil, fish oil, those are all anti-inflammatory. And in the right doses, in the right situation, those can help you because they're affecting a chemical process here. So chemical pain, constant, it's inflammatory, no relief from positions, and you may need an anti-inflammatory agent to calm that down first. That's what my patients needs, and unfortunately they didn't get that because I don't think their providers knew what chemical versus mechanical pain is. So what is mechanical pain? That's what I treat every single day of the week, all right? It's intermittent. It means it comes and goes depending on positions. You can ramp it up and you can ramp it down. It's nociceptive, which means that tissues are getting aggravated or irritated based on certain positions. Or it can be ischemic. Ischemic is fancy words for the tissue is lacking oxygen and it is lacking blood flow, all right? So we need to move it, mobilize those, but movement helps those types of problems. There is relief with postures, positions, and mechanics. I can move my spine into certain positions to make it better, or move my neck into certain positions, or move my elbow or wrist into certain positions, and it will feel better, right? You may or may not need an anti-inflammatory agent with this. It all depends on your level of pain. It all depends on how you're able to manage it and what positions can provide you that relief, all right? So there is an important distinction between chemical and mechanical, and if you're the viewer or if you're a doctor watching this, please know how to differentiate this because I think we all want the same things, our patients to feel better quicker, and getting them to the right therapy at the right time is important and critical. Thanks for watching. Please turn on those notifications. Please subscribe to this channel if you like this information.